Good morning students. Today's class we will see the sum of the give reasons in the pediatric nursing. The first question is cola colored urine is seen in acute glomerulonephritis. So first we will see what is acute glomerulonephritis. Acute glomerulonephritis is a type of kidney disease that occurs when there is inflammation in the glomeruli, which are tiny blood vessels in the kidneys that help filter waste and excess fluids from the blood. So, when the glomeruli are inflamed, they may leak the blood cells and protein into the urine, causing it to appear dark or cola-colored urine. That is why a cola-colored urine is seen in the acute glomerulonephritis because of the infection. It may inflammation. It may leak the blood cells. That's why it gives a typical cola-colored urine. The second question is, hypercholesterolemia is a common clinical feature of nephrotic syndrome. Why? Nephrotic syndrome is a condition characterized by excessive protein loss in the urine due to damage to the glomeruli, which are tiny blood vessels in the kidney. This protein can lead to decrease in level of albumin, that is a protein that helps to regulate fluid balance in the body. So, as a compensatory mechanism, when there is an excessive protein loss, the liver produces more cholesterol and lipids to try to replace the lost protein. This can result in elevated levels of cholesterol and triglycerides in the blood, which is known as hypercholesterolemia. In fact, it is not uncommon for individuals with nephrotic syndrome to have extremely high levels of cholesterol in their blood. The third question is, fluid replacement is the first line management in burns management. Why? Burn injuries can cause damage to the skin and underlying tissue, resulting in loss of fluid and electrolytes. The goal of fluid replacement is to restore and maintain fluid balance and prevent complications such as hypovolemic shock, renal failure, and electrolyte imbalances. In general, isotonic crystalloid solutions such as lactated Ringer's solution or normal saline are used for replacement in burns management. The fluid replacement rate is calculated based on the size of the burn and the patient weight, and it is typically started at the rate of 2 to 4 ml per kg per percent of burn area per hour. Next question, retrolental fibroplasia is a common complication of high flow oxygen therapy among preterm babies. It is retrolental fibroplasia in short, we can call it as RLF, also known as retinopathy of prematurity, is a disorder of the eye that can occur in premature infants who have been exposed to high levels of oxygen, particularly in the first few weeks of life. The use of high flow oxygen therapy in premature infant is necessary to maintain adequate oxygen levels in the body, but it can also lead to an imbalance in oxygen levels in the blood vessels of the developing retina. This imbalance can cause abnormal blood vessel growth and scarring in the retina, which lead to RLF. The risk of RLF is directly related to the amount and duration of exposure to the high levels of oxygen. To prevent RLF, premature infants who require oxygen therapy are typically monitored closely and oxygen levels adjusted to maintain optimal oxygen saturation levels without exposing the infant to high levels of oxygen. Next question is, projectile vomiting in infants with hypertrophic pyloric stenosis. Why? HPS, in short, hypertrophic pyloric stenosis, in short we call it as HPS. HPS is a condition in which the muscle in the lower part of the stomach, that is the pylorus, become abnormally thickened, causing a blockage that prevents food from passing into the small intestine. As a result, the infant with HPS typically experiences projectile vomiting, which is characterized by forceful and sudden vomiting that can travel several feet away from the infant's body. This vomiting is usually not preceded by nausea or wrenching and can occur after every feeding. So the food which is we have given to the infant will not be gone to the small intestine. So without any nausea or any feeling of the vomiting, the infant will have projectile vomiting in this case. The sixth question, head end elevation is recommended for a child with head injury. Head end elevation is recommended in children with head injury because this can help to prevent further injury and reduce intracranial pressure. Elevated intracranial pressure can cause brain swelling, which can further damage brain tissue and lead to complications such as seizures, coma, or even death. But recent research shows that head end elevation is not recommended for a child with head injury. In fact, it is generally recommended that the head of the bed is kept flat or slightly elevated, that is less than 30 degrees in children with head injuries, as this can help to prevent further injury and reduce intracranial pressure. The seventh question, the preferred site for IM injection for infants is vastus lateralis muscle. Why? The vastus lateralis muscle is located in the front of the thigh and it is the largest and most accessible muscle in infants. The vastus lateralis muscle is a safe site for IM injection in infants because it is well developed and have relatively large muscle mass. Additionally, it is away from major nerves and blood vessels, which reduces the risk of injury during the injection. The eighth question, chorea in children with rheumatic fever. Why? Chorea is a common feature of rheumatic fever in children. Rheumatic fever is an inflammatory disease that can occur as a complication of untreated or inadequately treated streptococcal infections, particularly of the throat. Chorea is a type of movement disorder characterized by sudden, jerky, and purposeless movements of the limbs, face, and tongue. Chorea is thought to result from the inflammation in the basal ganglia, a group of structures deep in the brain that are involved in the movement and other functions. The inflammation in the basal ganglia is believed to be caused by an autoimmune reaction triggered by the streptococcal infection. The next question is, squatting position is assumed by the children with tetralogy of fallot. Tetralogy of fallot is a congenital heart disease that affects blood flow to the heart and the lungs. Tetralogy of fallot of the right ventricle of the heart is usually larger than normal and pumps the blood that is lower in oxygen content to the lungs. During episodes of stenosis or difficulty of breathing, children with tetralogy of fallot may assume a squatting position, which increases the resistance to the blood flow out of the legs and increase blood flow back to the lungs. This helps temporarily to relieve the stenosis and improve the oxygenation. Squatting position involves flexing the hips and knees and leaning forward with arms braced against the knees or the ground. This position increases the systemic vascular resistance, which helps to improve the blood flow to the lungs by reducing the amount of blood shunting from right ventricle to the aorta. The next question is, sudden exposure to noise and light must be minimized for a child with meningitis. Why? Meningitis is a serious condition characterized by inflammation of the protective membrane surrounding the brain and spinal cord, which can cause the symptoms such as headache, fever, neck stiffness, confusion, and sensitivity to light and noise. Sudden exposure to bright light or loud noise can worsen the symptoms of meningitis and cause discomfort or pain for the child. This is because the inflammation in the brain surrounding the membranes can make the brain more sensitive to light and sound. Thank you. Thank you for listening.